Hello, APS parents and guardians. I'm Dr. Marnie McKercher, a registered nurse from the APS Health Services Department. I want to talk about the ways we can partner to keep our students and staff safe and healthy as we return to school this second semester. I want you to know that throughout this school year, we continue to follow the evolving science that guides our health protocols, and we follow all guidance as directed by the Colorado Department of Public Health and Environment and Tri-County Health Department. This diagram illustrates the Swiss cheese model of layers of protection. Not one method is without gaps, but by layering different protective measures, we can dramatically reduce the risk of exposure. I'm going to review more protocols than this Swiss cheese diagram illustrates. So imagine how protective it would be to use all layers. Masks or face coverings. Students must wear a mask on the bus or at school. This is mandatory for all students aged 3 and older. Masks need to be worn properly and should be washed regularly. Masks must be separate from clothing, such as a student may not pull their shirt up over their mouth and nose to act as a mask. Masks may be taken off during recess as long as social distancing is maintained. If your child has a medical reason to not wear a mask, please talk to your school nurse. And please practice wearing masks at home so the transition to school is easier. Home symptom screening. All students must be screened at home every day before arriving at school. Your student's school can provide you a copy of the APS Daily Home Self-Assessment Checklist that is available in both English and Spanish. You can see what it looks like on the right side of the screen. Let's review the symptoms on this form. The symptoms include new loss of taste or smell, chills or feeling feverish, dry cough, sore throat, shortness of breath, fatigue, muscle or body aches, headache, temperature of 100.0 or higher, nausea or vomiting, diarrhea, nasal congestion, or runny nose. Please do not send your student to school with any of these symptoms, no matter how minor. If you find that your student has any of these illness symptoms, please plan to isolate your student at home for 10 days. Isolating means staying at home and not going out in the community. Please contact your school to get return to school guidance. And as always, contact your student's medical provider for any serious medical symptoms such as difficulty breathing. Please consider to have your child tested if they become ill. See your school nurse for testing resources and contact the school with testing results, as this might shorten their isolation. Please report any illness to the school. Please call the school attendance line, and report your student's name with the spelling, a good return phone number, the date of the absence or tardy, and the reason for the absence. And if your student is ill, please list illness symptoms such as loss of taste or smell, fever, cough, diarrhea, or nausea. And also if your student has been COVID tested. For your student to return to school following an illness of any kind, please follow the guidances provided by your school. This is why it's so important for you to report symptoms to the school. Make sure your student's symptoms have resolved before sending them back to school, including that they have been fever-free for 24 hours without medication. And again, masks are required, and even more important since your child may still be recovering from the illness. If your student is exposed, meaning within 6 feet for longer than 15 minutes to someone who tested positive for COVID-19 or is sick with COVID-like symptoms. For an exposure outside of school, please keep your child home. Report this exposure to school and follow return to school exposure guidance. If your student is identified as being exposed to someone at school who has tested positive or is sick with COVID-like symptoms, you will be notified by your student's school. If your student were to become sick at school, know that students with any symptoms will be sent home and you will be notified. Please plan to pick up your student within an hour of notification. Please ensure that you have a current and working phone number listed in your student's online portal. You can update this information by simply logging in and updating your contact information or calling the school to notify them of any change in contact information. Make sure to have backup contacts listed in case you are unable to pick up your student if they become ill. Another important health protocol in staying healthy and safe is that none of us should touch our face, including eyes, nose, or mouth, or our mask. This is important for you and your student. Everyone needs to wash their hands frequently for at least 20 seconds, at home and at school. Aurora Public Schools also provides wall-mounted hand sanitizer throughout the district where staff and students can use as they enter or exit buildings or classrooms. Make sure that hand sanitizer that you're using at home contains at least 60% or greater alcohol. It's important for all of us to remember to maintain physical distance from those who do not live in our household. Stay at least 6 feet apart, and if less than 6 feet is unavoidable, ensure you have a mask on and reduce the time that you are in close contact. We know it's very important for our students to be in school and to be with friends. And however much we want to hug each other, we need to remember to greet friends by staying at least 6 feet apart as much as possible. We can wave at each other or even have a quick elbow bump. Another great health protocol that we all need to practice is to cover our cough or sneeze with our elbow or a clean tissue. This way, germs are less likely to spread into the air or from our hands to shared surfaces. Disinfecting. Know that district maintenance and school staff work tirelessly every day to keep up with daily disinfecting of shared school areas and frequently touched surfaces. APS maintenance also provides an extensive disinfecting process every evening. And just a reminder, don't forget to disinfect yours and your students' frequently touched items such as cell phones, keys, and writing utensils like pens and pencils. And lastly, get vaccinated, both adults and students. For students, this includes the Colorado required school vaccines and the optional seasonal flu shot. All of these are even more important during a pandemic to ensure that other illnesses are prevented. As you are eligible, please consider adding the COVID vaccine to your family's layer of protection. Stay tuned to when adults in your household become eligible to get vaccinated. The COVID vaccine is not yet available for children younger than 16, but trials have begun. So we hope that all students will be eligible for the COVID vaccine in the near future. Please do not hesitate to see your school nurse for any questions regarding COVID illness, COVID testing, and vaccination. If we all do our part to follow these health protocols and focus on the health and safety of everyone in our APS community, we reduce the risk of transmitting the virus to friends, teachers, and their families. We reduce the risk of sick or hospitalized due to COVID-19. We also reduce the risk your student or others are being placed in a quarantine. And we increase the progress toward our goal of returning staff and students to full in-person learning. Thank you for listening to this video as we work together to keep our school community healthy and safe. Please take care and stay healthy.